In part four of the integumentary system, we'll continue our discussion of the skin by taking a look at skin color and how an important vitamin, vitamin D, is formed in the skin. So, there are two pigments that are responsible for skin color. One we've mentioned before, which is melanin. The second one we haven't mentioned, which is carotene. So we'll take a look at where both of those come from. And then we also want to take a look at how blood flow in the dermis affects skin color. Right? We'll see if there's more blood or less blood will have an impact on skin color. So let's begin by taking a look at melanin. You could think of this as a brownish black pigment, but it even can have a little bit of a reddish yellow tinge to it too, so it's variable. This pigment is produced by a cell called melanocytes. So the melanocytes produce the melanin, and they're going to transport the melanin in these small little vesicles right here. We call them melanosomes. So let's go to a picture. This is actually a blow up of the stratum basale. If you remember, we said that the stratum basale was the lowest level of the epidermis, and that's where we found the melanocytes. So these brown cells right here, they're large, right? You can't miss them. These are all this here are the melanocytes. When we blow this up, this is a classic picture of a melanocyte. It's a large cell, and it kind of reminds me of an octopus that has all these tentacles here. So here's a tentacle, right? All these down here are tentacles, and they extend up into the upper layers of the epidermis where the keratinocytes are. So these little tentacles are going up in between the keratinocytes. So the melanin is produced let's go to this one here. The melanin is produced by the melanocyte. The melanin transfers up the tentacle, and then it gets to the tip, and this tip will pinch off. This tip, once it pinches off, is going to be called a melanosome. The melanosome will go into the keratinocyte cell and release the melanin inside the keratinocyte cell, and will change the pigment of the keratinocyte. Okay, so the intracellular vesicles are called melanosomes, and again, the pigment is going to be transferred to the keratinocytes. A person that has darker skin is going to have large, numerous melanosomes. Because again, the melanosomes are just continually bringing the pigment into the cells. We had mentioned this in part one of our lecture or our lesson that the melanin helps to protect us from UV radiation. Right, so small amounts of UV radiation are beneficial, we'll see, but too much, right? If you're out in the sun or getting burned all the time, can damage the DNA and cause skin cancer. Okay, so good, a good classic picture of a melanocyte. Now, carotene is a pigment we don't produce in the body, but we get from our diet. It's typically an orange, yellow type of pigment, and it's going to be found in orange vegetables. Right, if you think about like a sweet potato, that type of thing. Carrots, they're high in carotene. One of the things that happens is the carotene can accumulate and be stored in the epidermis, the lower part of the dermis, and the subcutaneous layer. So somebody that has a diet high in carotene can actually start to take on a yellowish orange tinge, um, because again the carotene is stored in those tissues. Now, the carotene is useful because it can be converted to vitamin A, and vitamin A is important because it helps to maintain our epithelium, and it also helps to for our vision, right? It helps to synthesize these different pigments in the eye. We'll actually look at this later in the semester. So the vitamin A is important. As far as blood flow, so hemoglobin, which is a pigment that's in red blood cells, is actually bright red when it's bound to oxygen. So now, if your blood vessels in your skin dilate, more blood goes into the blood vessels and our skin will become red. If blood flow to the skin decreases, the skin will become pale. So the way I like to demonstrate this, even in a lecture class, is if you take a look at your fingernail, as long as it doesn't have nail polish on it, just kind of push down on your fingernail, and you could actually push. If you push at the tip of your fingernail and push down, you could push out the blood into your capillaries and notice your fingernail becomes pale. Or if you go to the middle part of your, say, your middle finger and push towards your fingernail, we can actually push blood into the fingernail and it becomes like a deeper red. So depending on your diameter of your blood vessels in your skin, right, there could be more or less blood in the skin. Now, when there are low levels of oxygen, let's say somebody's not breathing adequately, or they're in a low oxygen environment, the hemoglobin actually turns like a dark, dusky red, and the overall appearance of the skin is that the skin turns blue, and we call that cyanosis, right? So again, if you ever come across somebody that's not getting good air exchange, right, they may have an appearance of a blue skin. All right, so things like heart failure, a breathing problem like asthma, or when somebody's in extreme cold or in lose body heat, maybe you're in a pool for a while, sometimes you see somebody's a little bit blue around the lips. That would be called cyanosis. All right, so the three things that help to control skin color are the amount of melanin, the amount of carotene, and our blood flow. Let's take a look at, we'll change the subject to vitamin D. So our epidermal cells can produce vitamin D in the presence of UV radiation. Like we had said a couple minutes ago, that some UV radiation is good. So here's what happens. When the epidermal cells are activated, they produce vitamin D in an inactive form. We actually call it cholecalciferol, right? This is not activated vitamin D. What will happen is the cholecalciferol will go to the liver. It actually receives like a hydroxyl group there, an OH group. Then it goes to the kidneys where it receives another hydroxyl group to become a hormone called calcitriol. Now, the calcitriol, since it's a hormone, is released from the kidney and it goes into the bloodstream and it goes to the small intestine and it tells the small intestine to increase the absorption of calcium and also phosphate. So, vitamin D ultimately will increase blood calcium levels. If for some reason vitamin D levels are low, it can cause a softening of the bone in children. It's called rickets. So I want to show you a picture from the Martini book. This is actually a good job that they do, where they take, if you notice here, is the epidermis, and once the sun hits the epidermis, there's a steroid in the skin that gets turned into cholecalciferol. This is again an inactive form of vitamin D. Cholecalciferol will go to the liver. It then goes to the kidney, and now it's turned into a hormone called calcitriol. You'll learn as you go through your studies, hormones are going to be distributed in the blood. So the kidney releases the calcitriol into the bloodstream and it targets the intestines. This is Martini's interpretation of the intestines, right? So this is the whole digestive system. And the hormone calcitriol stimulates the intestine to absorb more calcium and phosphates from the foods that we have in the intestines, and ultimately that's going to increase our blood calcium levels. So this is how we can see by being in the sun we ultimately will increase our blood calcium levels. This is actually a picture of rickets. It's something we don't see really in the Western world too much anymore. But years ago, let's say during like the Industrial Revolution, when the late 1800s, early 1900s, they would take children from their homes early in the morning when it was dark, bring them to a factory, and they worked all day in a dark factory, and then the children went home at night when it was dark, so they weren't exposed to sunlight. So obviously their vitamin D levels were low, blood calcium levels were low. What gets weak are the bones. So here you can see the just normal body weight of a child actually caused the bowing of the bones. Not that they were overweight or anything like that. It's just that the bones were so soft that they bowed out, and this is called rickets.